Hi, good afternoon, ladies and gentlemen. Thank you for joining us at the Saw Hawk School of Public Health Open Day 2023 virtual session on what you didn't know about public health. So I'm Jeremy, and it's my pleasure to be your MC for today's sessions. I'm currently pursuing my PhD and working as a research associate at the Saw Hawk School of Public Health. So as an alumni of Master of Public Health program, graduating in the class of 2021, I've gained a profound understanding and appreciation of the significance of public health. So my academic pursuit and my experiences have led me to realize the critical role that public health plays in our life and the importance of promoting its awareness. So our goal today, right, is to give you a taste of what public health is all about, and we have got amazing speakers lined up to share with their experiences with you. They'll be covering topics that you might not have thought about before, so I hope that you're ready to learn something new and interesting. So let's get started to have some very fun exploring the world of public health. So before we start, we have a few administrative announcements to be made. So kindly make sure that your microphone is muted and your camera is disabled for the duration of the session. And remember to submit your question using the chat features at the bottom of the meeting screen. So you may also do so at any time before and during the Q&A sessions. So let's get started. A very good afternoon and a warm welcome to the session on what you didn't know about public health. So let's start off the session with our guest speaker, Dr. Andre, who is a passionate educator at NUS Hawk School of Public Health. Dr. Andre specializes in teaching subjects related to health promotions and health behavioral change. He also has a keen interest in online learning and how to create engaging learning experiences for students. So Dr. Andre brings a wealth of international experience to the classroom, having lived, worked, and even laughed in various countries such as Germany, Korea, Malaysia, and the United Kingdom. So he received his bachelor and master degrees in physical activities and health from Germany in 2009 and 2011, respectively. And in 2016, he completed his PhD in sport and exercise psychology from the University of Malaya, Malaysia. So Dr. Andre's diverse background and academic achievement make him an exceptional teacher and a valuable asset to the academic community. So we're very lucky to have him with us today to share about what's health behavior all about and why do we need to care about health behavior. So Dr. Andrew, please.
Thank you so much, Jeremy. Just going to quickly share my screen. Okay, hello and welcome everybody. This is Dr. Andre. Thanks again for the nice introduction, Jeremy. So I'm going to today give you a teaser on what public health is also all about. And I will primarily talk about health behaviors and how our lifestyles really matter when it comes to our health and well-being. And of course, I'm also going to get you to engage in some good lifestyle behaviors because after all, we got to practice what we preach. Let's start first things first. You might wonder what impacts health actually. You might think first about genetics. Maybe your family or your friends might often say, well, it's all in the genes when I'm getting sick. And others think about health when it comes to medicine. So they would think, well, after all, when I'm sick, I will go to the doctor to get healthy. So medicine must have something to do with my health. But when you look at this picture here, you will hopefully see that what we do in our daily life has actually the largest impact on our health. So it's definitely important to look at this when it comes to our health. And what I've decided to do, I'm going to show you here the 6 lifestyle behaviors that make the hugest contribution to our health. And while I'm going through these behaviors very quickly, I hope you can, in your mind, think about how you do in terms of these behaviors. So for example, let's start with smoking. So smoking, probably you know what that is. And generally, the recommendation in Singapore is to avoid smoking altogether. So make an assessment, are you a smoker or not? Because I'm asking you later about it. Next, we have alcohol consumption. So that's obviously consuming alcohol. And in Singapore, there are certain limitations on how much alcohol you should maximum consume. So have a think about whether you think that you might drink too much. Next, we have dietary behaviors, and that's about what we eat and how much we eat. And you can see the guidelines here are quite diverse. There's something on fruit and vegetables. There's something on salt and sugar. So have a think about that as well. Now we are at sleep. As you might know, we should sleep about a third of our whole lifetime. And currently, as I assume we are all in the adult age range, we should sleep between 7 to 9 hours each night. So think about whether you hit that. Physical activity is also very important for our health, as you might know. And it doesn't include just exercise. It's also walking and even doing house chores. And think about whether you hit the Singapore and the World Health Organization guidelines of 150 minutes of moderate activity. So activity that makes you sweat and breathe a little harder. And last but not least, sedentary behavior. Sedentary behavior is basically time spent sitting, lying down, or resting during the day. And research tells us that these behaviors are actually very bad for our health. So think about whether you would say that you are sitting too much without any breaks on sitting time. Okay, I hope you have done these little mental calculations in your head. And I hope you can go to this poll here. So you just simply go to pollev.com/PA-health. It's at the top of the screen. And you just indicate how many lifestyle behaviors do you adhere to. If 0 would mean you are basically a smoker, a drinker, you don't do activity, you don't sleep enough, and your sedentary behavior is very high. So I give you a good minute to do that. So for everybody who has just joined us or coming in just now, think about how many lifestyle behaviors do you adhere to? Are you a smoker? Are you drinking a lot of alcohol? Do you eat healthy? Do you sleep enough? Are you active enough? And do you sit so much or not? Can I give another 10 seconds before we move on? Okay, 5 more seconds because we have a couple of people in the room. Okay, so what we see here is a very good picture of the Singapore population, I would say. It's very good that this pretty much is a good match. So we can see that actually very few people would do 5 or more of these lifestyle behaviors, and that the vast majority does probably like 2 to 4, something along those lines. And we have just a response with 0. Okay, great. And I wanted to tell with the next slide that you are actually in good company. So we did a little review on adherence to lifestyle behaviors to find out how bad is the situation in the world. And you can feel free to look through each and every little statistic here. But to just summarize it, most people, the vast majority of people across the globe do not adhere to many of these healthy lifestyle behaviors. So you can see, for example, smoking, 10 to 25% of people smoke in the world. In Singapore, it's about a 10% population. So have a good look at this for another 20 seconds, maybe. Okay, so you're in good company, but it's obviously bad news for us and for public health. And you might wonder, so what? Why is that bad news? Well, it's bad news simply because these lifestyle behaviors are contributing significantly to the main causes of deaths in Singapore and the world. If you look at the figure here and you start from the right, you can see main chronic diseases. So heart disease, you might know cancer, probably diabetes. And about 70 to 80% of deaths are related or caused by these diseases. And when you go then to the left and to the furthest left, you will see that these diseases are impacted by our lifestyles. So how much we eat and what we eat, physical activity, sleep, tobacco, and alcohol consumption. And that is why it is such a big problem and concern for public health. And now you might wonder, hey, so what to do? You tell us all of this about the lifestyle behaviors and that we are really bad, but now you want obviously some answers. But I said before, when I started about 6-7 minutes ago, that this is a teaser. So I'm just going to tell you that this is a problem. But in order to get some answers, you don't need to put your head in the sand. You can go study public health, interact with us, and hopefully find some answers yourself. Lastly, before I let you go, I've promised at the very start that I'm going to get you engaged in a lifestyle behavior that could improve your health right away. What I'm going to do is I'm going to show you a video that is about 2 minutes long, and it shows some very simple exercises. And I hope you could all get up from your chair and follow these exercises. These movement breaks, as I call them, are strongly related to health, but also to concentration and well-being. So hopefully you will do that because you can pay better attention for the next session. So I'm going to get up from my chair and then we get it going.
It's time for our quick, refreshing movement break. If you can, just get up for a short while and follow some light moves.
I hope you're doing this, otherwise, but it's for your health. It's all right. Okay, with this, I hope you enjoyed this little session and I thank you so much for your attention and hope to see you soon. Take care.
So thank you, Dr. Andre. And next we have Dr. Raymond Lim, who will be sharing why study public health. So Dr. Raymond Lim is a public health physician and a senior lecturer at NUS Saucy-Hawk School of Public Health. So Dr. Lim's academic contributions are numerous as he holds multiple concurrent appointments, including overseeing the minor and second major program in public health at the Saucy-Hawk School of Public Health, Director of Student Life at the Saucy-Hawk School of Public Health, and the Director of National University Health System Preventive Medicine's Residency Program. Dr. Lim's expertise cover a broad range of topics in public health, including health promotions, behavioral science, public health communications, diabetes mellitus, sexually transmitted infections and HIV preventions and control, public health education evaluations and pedagogy. He has co-authored over 40 publications in international reputable journal as first author, establishing himself as a leading figure in his research and teaching areas. So as a senior lecturer, Dr. Lim is committed to provide exceptional education experiences for his students. And with his extensive experience and notable achievement, we are delighted to have him today to speak on the importance of studying public health. So Dr. Raymond Lim, please, sir.
Thank you very much, Jeremy, for the kind introduction. Just give me a minute to share my slides. Hope everyone can see this. Yeah, good afternoon, everyone, and welcome to the online NUS Open House. Right, I will kickstart the session by giving an overview of what is public health. Hopefully, this can help to clarify some of the myths and misconceptions surrounding public health that you might have and give you actually more insights into what we as public health professionals actually do on an everyday job. Let me start by asking you a few questions. Not to worry, these are actually not the questions you will get for the university entrance examination, but will probably trigger you to think more in depth as to what really constitutes public health. Firstly, does public health encompass the control of disease and promotion of health through sanitation to ensure a healthier environment? For example, around 500 BC, the ancient Greeks and Romans have already begun actively practicing community sanitation measures. Or is it public health role to prepare for disaster response, both in terms of natural disasters as well as human-made threats? Now, or you can ask yourself, is it the role of public health to prevent and control the various risk factors of chronic diseases, right? Such as what Dr. Andre has mentioned. This could include unhealthy dietary behavior, physical inactivity, sedentary behavior, tobacco consumption, and etc. Or in more recent times, is it public health role to prevent and control the various outbreaks and epidemics arising from novel and emerging infectious disease? If your answer is yes to all of the above, I congratulate you on appreciating the broad spectrum of public health work. If your answer is no to any of the above, then all the more I encourage you to stay on for our talk so that I can clear up your misconceptions. Now, let me refer you to the definition of public health given by Professor Charles Edward Winslow, who was a highly regarded American public health expert in his time. His definition of public health remained highly relevant even to today's context. He defined public health as the science and art of preventing disease, promoting and prolonging life, and promoting health through the organized efforts of the community. Now, this is actually in deep contrast to clinical medicine, which focus on the individual patient and treatment. But for public health, our passion and focus is on prevention, which is always better than cure and towards the community and the population at large. So going on to that, how about we take a look at the public health situation in Singapore? In Singapore, public health professionals work as executive, managers, director positions in various settings, right? Such as in healthcare-related statutory boards, ministries, agencies, hospital operations and affairs, healthcare, human resource, finance, community health, and even our regional healthcare systems. They implement health promotion programs, develop healthcare policies, administer healthcare services, conduct research on health, public health, as well as regulate health systems to improve population and community health. Therefore, the scope of public health is very broad, particularly in today's context. Let me use obesity as an example. It is not only a global public health problem, it also clearly affects Singapore. Obesity is influenced by a diverse range of factors, from individual lifestyle behavior, which Dr. Andre has covered some of it in his talk earlier just now, to upstream factors, if you think about it, including the food and the physical activity environment which we are situated in, as well as policies and economic systems. Therefore, to tackle this public health issue, we need action and collaboration by various parties. Public health related work in this area could range from educating our population and our community on healthy eating habits, designing and changing the environment to increase population physical activity level, working with stakeholders such as the food industry to develop healthier food products, and all the way to creating and evaluating healthcare financing policies. Therefore, given this wide range of public health work, the field is indeed multidisciplinary in nature. It is not a surprising fact that modern public health practice requires professionals from different backgrounds. These diverse disciplines, which are not exhaustive, include life science, psychology, sociology, geography, social work, economics, communications, new media, computing, engineering, architecture, business, and many, many others, right? And these disciplines also happen to be the first major of most of NUS students. Therefore, public health as a second major or minor would be extremely highly relevant and complement most of NUS students' first major. It would definitely open up another route of employment for you when you graduate. I noticed there are some questions pertaining to this, which we'll address in the Q&A later, so please stay tuned for that. So then a common question you might ask yourself then is, why would a prospective NUS student being yourself be interested to enroll in our public health education programs? We actually posed this question to our students through study, and we found the top 5 reasons for them to do so. We hope that you have similar reasons to do so. The first reason is, obviously, among those who are keen, a quarter felt that public health courses are actually very interesting and relevant. Another quarter feel that it is relevant in today's context, especially as Singapore is grappling with an aging population, and as you can see, a lot of our health problems we are facing today has actually a social dimension to it. 1/5 hope to obtain more comprehensive training in public health, and another 1/5 cited the prospects of securing a job in the field of public health or healthcare, right? And last but not least, the last 1/10 of our student population felt that it is actually very complementary to their current major. Now, with this in mind, the Saw Swee Hock School of Public Health is the only national school of public health in Singapore. We currently offer the minor and the second major programs in public health. These are the program objectives. In general, the minor allows students to appreciate the multidisciplinary role of public health in preventing disease, as well as improving the health of communities. Second major, in comparison, is designed to complement students' first major, in particularly preparing them, right, for employment towards grooming their soft skills and perspective to work effectively as public health professionals, right, or in public health teams, right? Students would then graduate with the knowledge and approaches necessary to address today's public health challenge and improve population health. We are pleased to announce that ever since the start of the minor program in public health at our school, there's an increasing uptake through the years, right? In fact, it is currently the second most popular minor program in NUS now. For the second major program, which was just recently offered about 2 years ago, we are still in process of collecting our evaluation data. Right? For the evaluation of the minor program, the student feedback has been largely positive. Here we showcase here some of this feedback. Has seen students found that our lecturers in general are passionate about their fields and that the program broadens their career opportunities because it is recognized by the public health employers and we painstakingly took a lot of actions and all this to plan our curriculum, right? So that it is timely and recognition, right, by our public health employers. As of 2022, we have about 536 NUS graduates with a minor in public health, and the numbers are increasing, right? Later you will see the fruits of our labor. Later we have our alumni and people who go on to take their Masters of Public Health to share with us some of their experience when they're doing the undergraduate studies with us. So a very popular question definitely will come to your mind. Where do students who receive public health education in the university find employment? In actual fact, there are various settings. The list, again, is not exhaustive, right? The first group will be our international public health related organizations. The second group, obviously, would be the local ministries and the various governmental agencies. The third group will be your public as well as your private healthcare organizations. The fourth group will be your non-governmental organizations, your foundations and NGOs. Last but not least, the pharmaceutical companies and organizations. One question again, which might come to your mind is, could I then try out a few courses to see whether public health indeed suits me after you have successfully enrolled in NUS? Yes, definitely. Which is why I'm going to showcase here some courses which will be of interest to you. Right, first, we also offer the general education courses where NUS students could choose to fulfill their general education requirement. This is the Public Health in Action course, right? From the global increase in obesity, which I mentioned just now, to COVID-19. A range of health issues and solutions will be explored here in this course in the different contexts throughout the world. Students will work in small groups where they could debate and evaluate paths to address some of these global public health issues in a variety of cultural contexts. This allows students to develop an appreciation of how complex public health problems can be prevented or addressed using culturally appropriate ecological solutions. Right, you can see here some of the feedback here from the course. As can be seen, students in general like the exposure because it gives them a variety of public health issues and topics which they have never come across, and they have learned so much, right, from these various other sectors and the speakers. We also offer courses in the special term, right, which might be of interest to students during the application period. An example is the course on the health of the poor in Asia. The course introduces students to global public health, which focus on issues among some of the poor in Asia. So key issues explored by the course include the following. For example, what are the priority health issues that dominate the global public health agenda today? What are the societal factors that determine disease burden and adverse health outcomes in the subgroup? And of course, what are the community, health system, and policy levers that we could leverage on and available to reduce these disparities? Again, these are the feedback from the course and some of the snapshots of our past students. Students in general found the course to be an eye-opener. They not only learned about the healthcare and health systems, but it also, right, keeps them updated and get real on this as we talk about poverty and society issues that affect public health and health. Right, I know that future career prospects is very important consideration in all of our minds, and this is probably one of the very important decision points that you will consider when you are choosing a university. Likewise, for all of us as faculty members in the School of Public Health, we are utmost concerned with our future career prospects of our students. Right, let me introduce you to this internship course, right, which we have and offered, which is called the Public Health Practice course, which is a capstone module for our second major as well as an elective course, right, under the minor program. If you take a look at this course introduces students to the public health infrastructure and functions in Singapore, as well as providing the students hands-on exposure, right, by way of attachment at selected public health agencies. It allows students to explore already career opportunities in public health, develop related essential skill sets, specifically soft skill sets such as management of resources, interpersonal relationships, communication, and public health advocacy, and provides practical exposure to selected public health careers. All right, these are some of the feedback from the course. I can show you here. As seen from the feedback, students really appreciate the hands-on exposure, which allows them to translate what they have learned in the classroom and programs to the real-world setting, as well as to get the chance and opportunity to meet public health experts from various fields. Right, with that, I have come to the end of my presentation. I hope the talk has given you a clearer idea of what is public health. I hope to see each and every event. Thank you and all the best. I hand over to Jeremy. Thank you.
Okay, thank you, Dr. Raymond. And we are delighted to welcome back our alumni, Angeline Lim, who will be sharing her experience with us. So Angeline completed her Master of Public Health degree in 2021, following her completion of a major in social work and a minor in public health in 2017. So her academic achievement and dedication in the field of public health have paved her way for the current role as an assistant manager with the integrated care, with the group integrated care at National Healthcare Group. So we are excited to hear from Angeline and learn more about her journey and experiences in the field of public health. And let us give her a warm welcome. Angeline, please.
Thanks, Jeremy, for the very kind introduction. So Jeremy happens to be my coursemate. I took up the Master in Public Health. And so it's my pleasure to share some of my experience with you here today. So maybe I just start with why I took up a minor in public health back when I was in NUS as an undergraduate. So I had a scholarship under the MOHH Healthcare Awards to study social work and to work as a medical social worker upon graduation. And so in the design of the modules and that I will be taking in NUS, I had considered exposure to health and healthcare systems during my undergraduate studies. And therefore, I took up the introduction to public health, which is public health in action that Dr. Raymond introduced earlier. And it also propelled my interest to learn more. The minor provided me the foundation in terms of looking at systems and diseases from a public health point of view, and how health and social outcomes are actually correlated. So during my stint as a medical social worker after my graduation, for about 4 years, I was working in Singapore General Hospital as a social worker. And I worked with patients, many of them requiring amputations or even dialysis as a result of diabetes complications. And during my stint as a medical social worker, actually, I reflected a lot about the learnings from the minor in public health that I took. And therefore, it spurred my interest to take up a master in public health to follow up on the studies and to learn more. So the minor in public health actually developed my systems thinking skills in the delivery of health and social care. And this really coincided very well and complemented my role as a medical social worker when I work with patients with disease and various health conditions, taking into consideration biopsychosocial model. So apart from the biological conditions that we have, and also the psychological as well as the social factors that will ultimately influence their lifestyle behaviors, as Dr. Andrea pointed out earlier, the 6 big lifestyle behaviors, and how it ultimately affects the health of individuals as well as the population. And through the Master of Public Health, I actually learned more about how we can reduce health inequity, improve population health. I had particular interest in integrated health and social care, given my background in social work. So currently, I'm working in National Healthcare Group. So National Healthcare Group is one of the 3 public healthcare regional health clusters in Singapore. And we are actually appointed as a population health manager for about 1.5 million residents living in the Central North region. So under National Healthcare Group, we have various institutions such as Tan Tock Seng Hospital, Khoo Teck Hospital, National Healthcare Group polyclinics, and various other centers, as well as NHG Diagnostics, NHG Pharmacies that's under our organization. Yeah, and my role in group integrated care actually involves strategic planning for vertical and horizontal clinical integration. So you may ask, what does that entail? So actually, I'm involved in the planning and development of preventive strategies, and currently specifically in terms of weight management and smoking cessation. So both were the key lifestyle behaviors that Dr. Andrew mentioned earlier. So in terms of the preventive strategies for various levels of prevention across various health settings. So from the community all the way to primary care, as well as the hospitals. So we want to sort of come up with end-to-end care coordination of care for our residents and our patients. With the Healthier SG rollout this year, I'm also responsible for developing the clinical support to enable our general practitioners to enter appropriate care in the primary care setting. So yeah, I'm very thankful for the opportunity to have studied public health through the Saw Swee Hock School of Public Health, and I will be happy to share more. Thank you.
Thank you, Angeline. So let me share the screen again. Okay, thank you, Angeline, for sharing. So as we are near the end of our sessions today, so we are delighted to have two current students, Grace Tan and Hannah Feng, to join us today to share about their experiences in the world of public health. So Grace Tan is a Year 4 political science student with a second major in public health, while Hannah Feng is a Year 4 business administration student with a minor in public health. So we are excited to hear from Grace and Hannah and learn more about their experiences and perspective on the importance of public health. Let us give them a warm welcome as they share with us their insights. So Grace will be presenting first. So Grace, please.
Yeah, thanks, Jeremy. So I'll just be sharing my screen. Right. Hi, everyone. So I'm Grace, and I'll just be sharing a little bit about my undergraduate journey in public health thus far. And hopefully what I say will reinforce what Dr. Raymond and Angeline have shared, and hopefully this will inspire some of you to join Saw Swee Hock School of Public Health as well. So here's a little bit about me before we move on. So as mentioned earlier, I'm a political science major with a second major in public health, and I'm currently in my final semester as an undergrad. So I'm also the acting president of the NUS Public Health Club, which is the club that services the public health minors and second majors. And previously, I was also in the NUS Political Association. So for your convenience, I've also listed the modules that I've taken for my second major. And as you can see that other than the core modules, which are 6 of them, I've also chosen to pursue my interest in statistics and non-communicable diseases. And because I was a social scientist, I'm also interested in some alternate perspectives to health, which is why I took this novel module about medical sociology. That being said, there are plenty of other modules that you can choose from to fulfill a minor or second major in public health. But if you have similar academic interests, you can feel free to ask me questions about it later in the Q&A. So from here on out, I'll just be flashing pictures and describing my experiences through those images. So firstly, I want to address why I chose NUS, then the SPH minor, and then why I bumped it up to the second major. So firstly, the decision to choose NUS and to read a minor in public health was extremely easy for me because initially, before I decided on the university, I already planned to read public health as a course of study, and I initially intended to go to Johns Hopkins, but I got rejected. So NUS was an easy choice for me also because there was an established public health school and also a public health interest group already. So that means that I could easily identify and connect with a community in here the moment I got in. So as soon as I could, I declared a minor in SPH as well. And I think it was extremely helpful that the modules that Saw Swee Hock offered were quite complementary to my political science ones as well. And I've listed some of them here for your convenience. So notably, the systems, thinking, and policy modules were quite complementary to the ones in political science. And also, as I mentioned earlier, I was interested in statistics and methods, and I could get the exposure from both sides, the public health side as well as the political science side. And by the time I fulfilled the criteria required to apply for a second major in SPH, which was in year 2, I was already seriously thinking about career in health administration or policy. So that was an easy decision for me to bump it up for a deeper understanding of public health systems in Singapore. So because I completed my second major already, I've identified 3 trends in SPH modules that you can look forward to if you do decide to join us. So firstly, because public health is inextricably linked to changing and explaining social behavior, you'll be taught a lot of frameworks and models, and you'll be expected to apply them in real-world situations and in examinable settings. So especially the one in color, it's the socio-ecological model, and it'll keep recurring in SPH modules, and eventually you'll start thinking about phenomena outside of SPH classes as well. And I particularly also like the status of change model over there because it was something I learned in the SPH module and I got to apply in an internship with the Health Promotion Board. Secondly, very quickly, every SPH undergrad will agree with me that there's group work in almost every SPH module. So this might sound dreadful to some of you, but teamwork, at least for me, is really the nature of public health work in real life. And personally, I saw that group work was a good experience and opportunity to exchange ideas with people from different disciplines. And also it was a welcome respite from my political science modules, which were almost always solitary research work. Also, I was lucky enough to have teammates who pulled their weight most of the time. And when I didn't, the SPH module luckily has a peer review segment that was my opportunity to flag out people who did not contribute during the module. So not to worry, the group work is actually a good thing and a thing for you to expand your horizons on, really. So the third thing that I want to highlight here is that you'll see a good mix of assignment modes when you take more than one SPH module. So while group reports and presentations are given for modules with group work, I've also had to write opinion pieces, long form essays, do quizzes, as well as worksheet assignments, as you can see from the screenshots of assignments I've submitted. So this was quite enjoyable for me because it contrasted the assignment style that I was used to in political science. So on a closing note, here are some takeaways I have from being in the public health program as well as in the club. So reinforcing what Dr. Andre and Dr. Raymond have mentioned, I think what stuck with me the most from the public health modules is the idea that health outcomes are a result of a deep network of determinants and risk factors. So I strongly believe that anyone who possesses this knowledge would naturally be more discerning and more conscious about improving their health. And that was the case for me. So the knowledge has transformed into a shift in how I perceive my health and of those around me. So that was why I was inspired to modify my lifestyle and pick up cycling during the pandemic. And in the picture is also my brother, so we picked up cycling together. Well, secondly, having the public health second major and being connected to the school and club also granted me opportunities and connections that I would otherwise have never gotten. So I think the club experience and reading modules under SocieHawk have mutually reinforced my people skills and have led me well in obtaining these opportunities. So to list some, let me just start with my experience in club. I was researching with the faculty and I managed to publish a scoping review on tobacco policy. This lands me well in my SPH 301 capstone module, which allowed me to work with faculty again to initiate a systematic review on COVID-19 excess mortality. So these experiences lent me the opportunity to work in Ministry of Sustainability and Environment, where I worked on indoor air quality policy, and then in the Ministry of Health and then Health Promotion Board on tobacco control policy, as well as the ongoing vape-free campaign. And under SocieHawk School of Public Health, I also got to volunteer for the Global Health Security Conference, which is the picture you see in the group. And that allowed me to network and connect with public health professionals around the world and enrich my understanding of issues threatening health security. So lastly, I think this picture speaks for itself in saying that I made plenty of great memories through my involvement in public health here in NUS. So I think if you're looking to find like-minded individuals who are passionate about preventing disease and promoting health, I think it's a good idea to join NUS and to enroll in our minor or second major. So with that, I've come to the end of my presentation. Thank you for listening. And if you do want to contact me outside of the session today and to ask me further questions about public health, do reach out to me on LinkedIn. Thank you. Okay, I'll hand it back to Jeremy.
Oh yeah, now we can have, let's welcome Hannah to share her experiences.
Okay. Hi, everybody. Hi, so I'm Hannah. I'm a final year business student at NUS. I'll be graduating this semester, and I have also taken a minor in public health. Okay, so myself, maybe I can share a little bit about what made me decide to take on this minor. So I was very interested in the healthcare industry, and I was actually recommended by like my seniors who are in the healthcare industry currently to take on this minor. So my seniors who are in like healthcare institutions or in their executive management program, they recommended this minor because they said that, you know, it's a very good entry point to understanding the current healthcare landscape. And at the same time, you will find modules that you like. When I say that, I mean that because the modules that they offer here in the program, they're not just centered on public health, but they also incorporate a lot of aspects from other modules as well. So for example, on public health communication, you understand a little bit about the public health landscape, but at the same time, you could be incorporating aspects or theories from like, let's say a marketing module. So I'm quite sure that if you join this program, you'll definitely find a module that interests you. Okay, and for myself, I have learned quite a little bit. So definitely I understood more about the healthcare landscape in Singapore. And I've also learned about specific terminologies or theories that could be helpful for a future career in healthcare. So for example, understanding like what Grace mentioned, the social ecological model, understanding the logic model, you know, how people think when they design public health interventions and so on. So, okay, let me go on to what you can expect if you join this program. So firstly, you can expect very practical projects. So something that really intrigued me about the modules and the program thus far is that the projects that are assigned to you are very relevant. So it's not abstract. It's like things that you probably see in Straits Times, you know, you see on news or you've heard about very recently. So for my last 3 modules, I have taken up projects involving HIV intervention, you know, how to get people to seek treatment. We have also looked at mental well-being for people who are grieving. And currently in my module under Dr. Andre, we are looking at how to promote physical activity for the elderly. So all these are very relevant topics, I would say, and it really gives you an opportunity for deeper understanding and research, you know, into these public health issues, which for myself at least, otherwise I would not have wanted to do so. So it really gives you a very good overview and propels you to learn a lot more about current issues. Secondly, I think I've also been very blessed in my modules to have professors who are very experienced in the field, and they very willingly share about personal anecdotes in class. So for example, in a module on designing public health interventions, my prof, Dr. Liao, he was actually involved in HIV intervention programs overseas. So he did very applicably relate like concepts that we're learning in class to like examples that he himself had gone through when he was designing these programs. So I would say it's very applicable. You know, you know that what you're learning is not simply based on theory. You also see how it's applied in a bigger picture. Okay, and to round this up, I think like the module really teaches you how the modules here and the program thus far, it really just teaches you to be more analytical and holistic. Because public health itself, there's a lot of data, there's a lot of synthesis, there's a lot of stakeholders. So through all my modules so far, I've really learned how the different players are linked together in like one ecosystem and how we can target different aspects with these different players. And the healthcare industry, I think it's going to continue to rise, not just locally, but globally as well. So with our aging population and greater disease outbreaks, I think it's important to understand how this will play out in future. So if you are interested to understand more about the healthcare landscape and tools for analysis, like understanding how people design interventions, how healthcare policies analysts think, and so on, I would say that it's a great opportunity for you to take up this program. And from personal experience, I also think that this reaffirms your passion for the industry, for healthcare, and this would be a little bit of a differentiating factor, you know, when you apply for internships or for your future career experiences. And even if you're not interested to join the healthcare industry now, I think like what skills you can pick up through the modules, for example, data analysis, modeling, economics, they can all be relevantly applied in your future career as well. So with that, with this short sharing, I hope you can consider taking up an opportunity in this SSPH program. Thank you. Jeremy, back to you.
Thank you, Anna. So let me go to the slide. Okay, thank you, Hannah and Grace, for the wonderful sharing. So we have reached the Q&A segment of our session, and I will be serving as a moderator. So if you have any question, please feel free to use the chat function or use the raise your hand functions found under the reaction. So if you choose to raise your hand, you'll be asked to on your camera and unmute yourself to ask question. So we welcome all the questions related to today's discussions. So as you mentioned, public health trainers a lot of skills. One of them is to quickly classify all the questions that I found in the chat box. So today, right, later on, I mean, like for now, the Q&A, right, we will be discussing three major themes. So the first theme will be experiences of other major and minor in public health. Second theme, right, will be on career prospect, and the third theme will be on the university requirement. So let's talk about the first theme, which is on their experiences on those complementary major and minor in public health. So there are many questions on what kind of majors complement well with minor and second major in public health. So the first question would be directed to Angeline. Angeline, I know that you are a social worker. So would you like to share with the audience, right, what would social work be a good complement or with minor in public health? And is it, I mean, like if someone is got to take up social work as a degree because of their scholarships, right, would it complement better with public health or psychology? So Angeline, please.
Thanks, Jeremy, for the question. Yeah, I think Dr. Raymond mentioned earlier that the whole ecosystem in the country actually taps on a lot of public health expertise in the various settings. So apart from social work, there's engineering, there is pharmacy, there's various healthcare settings, for social work specifically, I think where it came in where it struck me during my during my stint as a medical social worker was when I was working with patients who had suboptimal health outcomes or compliance to their health sort of treatment or their regimes. So, for example, just giving a very simple example as to patients who do not turn up for the appointment. From the healthcare provider point of view, it could be because the patient just isn't interested or he's busy. But actually, when from social work, when we are doing case management, when we get to know the patient and to understand what are the psychosocial reasons, the psychosocial factors of why patients do not practice the health behaviors that are ideal or that are even prescribed to them, then it could be that their social circumstances may not allow it. So, for example, the patient may actually be relying on sole income, and if he does not go to work that day, he might not have any meal to bring home to his family. Yeah, so I think really understanding these determinants of health, these social factors that affects human behavior. I think it helps in terms of shaping whether is it programs or policies to uplift the vulnerable population in the society. So that is my conviction as a social worker. But on a population health perspective, actually, different population, different demographics profile of patients or residents may have different kind of traits and attributes, and by understanding how each archetype of subpopulation behaves and interacts, then from a public health practitioner point of view, then we are able to prescribe or design programs, interventions, even advocate for policies to enable better health. Yeah, so I think that's for how social work relates to public health. But I wouldn't say that social work is the only major that or the only setting where public health is relevant. Yeah.
Thank you, Angeline, for giving a very insightful experience as alumni. So now, right, let's talk about some of the majors that Hannah and Grace have took. So the major that they took is somehow not really directly relevant to healthcare or public health itself. So maybe you can start with Grace. Can you share with us like how political science integrate well with your experience in public health?
Right, okay. I think as I shared earlier, my experiences in political science are quite like deeply theoretical. And I see public health as a bit of a specialized case study / extension to what I've studied in political science, really. So I think, yeah, I guess I found my niche or my interest in political science not to be more of the theoretical ones, but more so the policy and more practical aspects of it, which NUS political science is certainly not known for. So I guess public health is a respite for me to go and to ideate and think about these issues and then sort of implement it in the group projects that Hannah has kind of raised before. I think otherwise, the research methods is an area that's particularly complementary otherwise. So like for me, I have an interest in quantitative methods. And what I did was to take a couple of modules in, I mean, there's the core module SPH 201 that deals with quanti and quali methods at the basic level. And then I extended that interest into biostatistics modules with which taught me more than just regression models, but that was a while back, so I don't really remember. But otherwise, I think the skill sets that I learned on data cleaning, data analysis, using statistical software like R, those skill sets were easily applicable to my political science major because there was a module called quantitative methods that dealt explicitly with those subjects. So yeah, that's where the complementary lies in.
Thank you, Grace. And yeah, so we from your experience, you know that there are different skill set that we can derive from public health, especially using biostatistics. And we have cross-disciplinary students nowadays, and Hannah is one of them. So Hannah, can you share with me how you juggle or like how you juggle between business administrations and your experience in public health?
Yeah, okay. For myself, like I actually really like the healthcare industry, and that's where I aim to go to. So I found it very meaningful, and that's why I chose to move into there and take up public health, right? But maybe I can just give some example about how it may be interrelated. So for example, let's say you're taking a specialization in marketing in business school. And let's say, you know all those HPB posters you see on the MRT, right? Yeah, there's some part of communication and marketing that goes on in that campaigns, right? It's not simply just, public health, looking at like the stakeholders and the people that you want to reach out, but there's also aspects of like how you can best reach out to this target audience. So I would say it really depends on which area of in the industry that you want to go to. Do you want to go to policy? Do you want to go to designing interventions and so on? Because that really dictates like the type of module you want to take and the type of theories that will come along with it, and how you understand the background differently, and how you can incorporate your current skill sets into what you've learned in public health. So it's how you like to see your future career going on. Yeah.
So it's kind of breach your interest, into the healthcare industry. So this brings me back to healthcare related. So specific to medicines, right? So the curriculum could be a bit different compared to other major. So specific to medicine, right? So Dr. Raymond, at what point, right, can one apply for a second major in public health, or what is the connections between the program and your Yong School of Medicine itself? And is it even possible for medical students to pursue a second major in public health?
Thank you for the question, right? The minor and the second major programs are open to students from any faculty or school, with the exception of medical and dentistry students, because for these two groups of students, the medical and dentistry students, we have dedicated public health training programs built into their curriculum. So students from these two faculties, unfortunately, they are not able to enroll in the minor and the second major programs per se, right? Because there's a different kind of track. But that said, right, after their training and all this, they could consider specializing in public health dentistry, or has a specialist being accredited as a specialist in public health medicine. That's where the preventive medicine residency program comes in, right? So it's a slightly different track for this group of students. But other than that, right, the all other students from other faculties and schools will come, and they're open, right, to apply for the for the minor program, which is an open program. So any students can just apply this and declare on the system, no later than the end of the 5th semester for the minor program. For the second major program, it's a closed program, so it's by application. You have to send in the application, and for the details, you can check out on our school website.
Yeah, thank you, Dr. Raymond. And yeah, so it's good that the dentistry student and medical student have get the opportunity to learn public health within their core curriculum. So this is a follow-up to to some of the student concerns with regards to career prospect. Our team today, second team today. So what are the career opportunity available for the student who opt for minor in public health? And are there any differences for those who pursue a second major instead?
Yeah. Again, thank you for the question. As shared just now, and from the data that we've collected from alumni and all this, right? Students who graduated with a minor and second major program, they really go into various settings and fields, right? I think some of this we have mentioned in terms of the international public health related organizations, the ministries, the agencies, and public and private sectors, including NGOs and the pharmaceutical companies and organizations and all this. But the key difference between the minor and the second major program, I would say the minor program is like an introductory program, right? Where probably has a new student, as a student to be, a prospective student, you might not be so familiar with public health, but you are considering to explore this as a potential career of interest, then please take up the minor in public health, because the minor can potentially be converted, right, to a second major, right? Because this is how usually happens. Our second major students, almost all of them, right? They actually come from the minor program, but they actually send in the application and all this and be converted to second major students. So this is a route for them to be exposed to a number of courses and modules and all this, for which after experiencing, then you will realize whether this is the right fit for you and all this, right? The second major program itself, because of its nature, because it's the double curriculum requirement for compared to the minor only 20 modular credits, but for the second major is 40 modular credits, which works out to about 10 courses or modules which you have to take. So this gives ready students the space, the breadth, and the depth. Right, so if it's really for someone who is really seriously considering a career, and they know that I'm, for example, going right to do something related to health promotion, to health policy, then this is a area and all this. Then probably I want to upgrade this to a second major where I have more training with respect to that, and also more opportunities, because again, the public health internship module, the public health practice module, which I've shared just now, is a capstone module, which every second major student must complete and fill. Whereas for the minor student, that is an elective module, and priority will be definitely given to second major students because these are the groups that are with the mindset and all this, wanting to carve out a career and all this. But let's say a lot of students from our minor program, they also carry on with some of the skill set and all this. Not forgetting that it is actually a long journey. The undergraduate programs ultimately serve as the foundation and for junior and entry-level positions, right? Because the school offers the postgraduate programs, which you as you rise up the public health career and all this, you will probably take that up to further enhance your skill and rise up the hierarchy and the job position.
Thank you, Dr. Raymond, for sharing. I think these are very useful information for those who are conflicting, to know what to choose, whether to minor or major. So yeah, some other, we have like around 4 more minutes, so we have a few more questions which is pertaining to university requirement. So probably for this will be for more applicable for Grace, because you took a second major in public health, right? What are the criteria for to take up second major in your faculty itself?
Oh, in my faculty, I think, frankly speaking, right, times have changed from when I entered to like 2021 because the CHS merger thing happened. So I'll just speak from my experience. What happened was that I wasn't eligible for the second major all the way until my 3rd year, 1st semester, because the requirements were that I needed to take 4 SPH coded modules. So there was 16 credits worth of it. Then there was a selection process where you need to apply both on ModRec and through the Sociolog portal internally. And in the Sociolog portal, there was a selection criteria that required a written statement. And yeah, then you'll be filtered through to see your eligibility, whether you're able to complete your modules on time, whether you were going to the program for the right reasons, because after all, it's a restricted second major. And yeah, then after that, I got through and I started completing my I started doing the elective modules in year 3 onwards. Yeah.
Thank you very much, Grace, for the sharing. I could just jump in to add on to what Grace has shared. Because I think we have reduced, that was during Grace time. So we have reduced our modular requirements to just 12 MCs, right? Which is about 3 courses and 3 modules, right? Before one can apply for the second major. And that also corresponds, that the number of modules also corresponds, also applicable. When you are actually applying, you are also taking the modules itself. So that also itself is also counted, right? So that is the revised criteria as of now. For the minor program, as mentioned, is an open program, no criteria, anyone, right? Except students from medicine and dentistry can apply for the module through the NUS system, no later than end of their 5th semester. If they wish to do so after the end of the 5th semester, they need to seek permission from their home faculty, right? After which, then we can allow this to happen. Thank you so much. Yeah.
Thank you, Dr. Raymond, for giving us a latest update to the second major. And yeah, students love attentions. So given the popularity of minor in public health, right? What is the usual class size for most of the modules for undergrad? Maybe it's open up for Hannah, Angeline, and Dr. Raymond. Any of you can just speak from experience. Oh, maybe we can start with Dr. Raymond. Yeah.
Yeah.
Class size.
Can. Yeah, I think thank you for so much again for the question. The class size usually varies. So for example, for our general education modules, which is now not one of the you can't use it, right, for the to fulfill the minor requirements, right? Because it's more for the general education component and class and all this. The class size usually about 200 students at one go, right? Because it's again, it's one of the very popular subscribed general education modules. So usually we host about 600 students every semester. This is the largest class that we have. To the core module itself, for example, core modules like the public health and epidemiology and fundamental public health research methods, the class size usually range from about 80 to 100 students, or even 120 students like that. Most classes in other modules, for the bigger classes and all this, 50 to 60 students. The smaller classes for about 20, 30 students like that, right? Because again, some of the modules a little bit niche, right? So a little bit niche and all this, probably the enrollment will be slightly smaller in terms of number, but for the core compulsory modules, that's where you have the bigger classes and all this. But let's say for these bigger classes and all this, we would have breakup sessions, tutorials and all this, where where you can conduct discussion in a more effective, smaller group size. Yeah, thank you.
So thank you, Dr. Raymond. So fret not, because you can see from the positive comments from Dr. Raymond Lim for most of the modules, I believe, right, all the students will have opportunity to learn the skills and also have the opportunity to interact well with the faculty. So now it's 2:10, so let's close the Q&A session, but do not worry, let me share the screen. So feel free, right? Thank you for attending today's sharing session. Of course, our amazing speakers will have shared from their experiences and also wonderful insight. So we hope that you found the information and experiences shared by them valuable and informative. So if you'd like to know more about the Sociolog School of Public Health, please scan the QR code to know more about us. So this is the QR code to Sociolog School of Public Health. And if you have more questions, please feel free to scan the QR code over here provided to submit your questions via the e-form. So we will get back to you shortly as soon as possible, and hope that just now we have tried to categorize and most of the questions in a way that it flows nicely. So feel free to scan the QR code if you have further questions, and don't miss out the chance to learn more about our school. So do drop by at our booth at the College of Alice and Peter Tan at University Town Multipurpose Hall, booth D5 this Saturday from 9 a.m. to 6 p.m. So if you're interested to find out more about why you should study public health, attend Prof. Liao Qixiang, our Vice Dean talk at the Stephen Riady Center, Level 1, Global Learning Room, Room A9, and there will be 2 sessions. Session 1 will be from 10 a.m. to 11 a.m. and session 2 will be from 2 p.m. to 3 p.m. Do remember to scan the QR code as you can see from the screen and register now. So don't miss the opportunity as you will gain valuable insights and information from our speaker by Prof. Liao. So once again, thank you very much and look forward to see you in person this Saturday. Oh, sorry. Yeah. So this is the open house pamphlets, and do remember to scan the QR code over there to register your interest. Yeah. So once again, thank you very much and look forward to see you this Saturday. And don't forget to follow us on social media platforms for more updates. Thank you very much. So this is the QR code to register for this Saturday sessions. Yeah, you can see from here. Yeah. So thank you, Patricia, for supporting. Okay. Yeah. Yeah.